Hi, my name is Stephen McGee. I'm the author of Health Forensics and Hypoxia, Mental Illness and Chronic Fatigue. And that is me on top of the world's largest telescopes, the WMKEC Observatory at the top of Mauna Kea. We're here to discuss the book Toxic Altitude. And again, that's me, and that's the world's largest telescopes right there, the WMKEC Observatory. We're going to look into this subject today, and it's oxygen hazards. And you'll find it on page 15. So we're on page 15 of Toxic Altitude. So let's take a look into oxygen hazards. So, is breathing oxygen hazardous to health? According to doctors, it is. I have been repeatedly told by lung doctors that breathing oxygen makes the lungs lazy. Once you start regularly breathing it, you'll become dependent on it. The following oxygen hazards are known. It's a hazardous substance. It causes fires. So just a little bit of oxygen in the atmosphere that raises it to 23.5% is called an oxygen-enriched atmosphere. Increasing the oxygen levels in a room increases the fire risks. It may be impossible to put a fire out. Releasing oxygen into a room may raise the oxygen levels to a dangerous level. People can easily set their hair and clothing on fire when breathing medical oxygen. It causes reproductive damage and may damage the unborn fetus. Mutations, it may cause cancer. Asphyxiation, oxygen deficient below 19.5% or oxygen enriched above 23.5% environments by volume may cause asphyxiation. So according to this, too much or too little may kill you. So, known long-term health issues of oxygen-enriched air. So this is above 23.5% oxygen in the air. Causes damaged cell membranes. Collapses the alveoli in the lungs. Retinal detachment, so that's the eyes. Seizures. So that's interesting because I was actually diagnosed with seizures after using medical oxygen in high altitude astronomy. There I am at the WMKEC Observatory. So most summit workers are breathing oxygen during their workday and enriching the rooms where the oxygen cylinders were with oxygen. It was common to see workers in the medical room using the oxygen in there when the 3 facility oxygen cylinders were all in use. I would often see workers queuing up for their turn on the magical medical gas. I have had to queue many times for my turns on it with a massive headache. Delaying oxygen administration to a summit brain worker is undesirable. So this summit brain is a term that the management team uses on Mauna Kea to describe what happens to the brain in workers. So they start exhibiting strange behaviors after not using oxygen for a while. So using oxygen alleviates some of the summit brain. So it doesn't fix everything, but it makes them a little bit better when they breathe oxygen for about 15 minutes. So what the workers are doing up there is they're breathing intermittent oxygen. So they go up there, and when they start to experience summit brain at very high altitude, which typically occurs after a few hours of being up there, they start having intermittent oxygen sessions. So it's a little bit like an oxygen bar. They go over to the oxygen bar, they breathe their oxygen for 15 minutes and go back to work feeling better. So what's that doing to them? So oxygen is known for its toxicity to the human. The Wikipedia article, Oxygen Toxicity, states, oxygen toxicity is a condition resulting from the harmful effects of breathing molecular oxygen at increased partial pressures. Severe cases can result in cell damage and death, with effects most often seen in the central nervous system, lungs, and eyes. Historically, the central nervous system condition was called the Paul Burt effect, and the pulmonary condition the Lorraine-Smith effect, after the researchers who pioneered the discoveries and descriptions in the late 19th century. Oxygen toxicity is a concern for underwater divers, those on high concentrations of supplemental oxygen, particularly premature babies, and those undergoing hyperbaric oxygen therapy. The result of breathing increased partial pressures of oxygen is hyperoxia, an excess of oxygen in body tissues. The body is affected in different ways depending on the type of exposure. Central nervous system toxicity is caused by short exposure to high partial pressures of oxygen at greater than atmospheric pressure. Pulmonary and ocular toxicity results from longer exposure to increased oxygen levels at normal pressure. Symptoms may include disorientation, breathing problems, and vision changes such as myopia. Prolonged exposure to above normal oxygen partial pressures or shorter exposures to very high partial pressures can cause oxidative damage to cell membranes, collapse of the alveoli in the lungs, retinal detachment, and seizures. Oxygen toxicity is managed by reducing the exposure to increased oxygen levels. Oxidative damage may occur in any cell of the body, but the effects on the three most susceptible organs will be the primary concern. It may also be implicated in damage to red blood cells, hemolysis, the liver, heart, endocrine glands, adrenal glands, gonads, and thyroid or kidneys, and general damage to cells. In unusual circumstances, effects on other tissues may be observed. It is suspected that during spaceflight, high oxygen concentrations may contribute to bone damage. Hyperoxia can also indirectly cause carbon dioxide narcosis in patients with lung ailments such as chronic obstructive pulmonary disease or with central respiratory depression. So that article is on Wikipedia. That's a shortened version of it. You can read the full article if you go to this link, which is, the actual article is called Oxygen Toxicity on Wikipedia. So something that's interesting in here is it talks about spaceflight. So spaceflight is probably the most comparable to what is going on top of Mauna Kea at the world's largest telescopes there. So in spaceflight, they're saying high oxygen concentrations may contribute to bone damage. So that's very, very comparable to Mauna Kea. So spaceflight causes bone damage. Okay. Based on what I saw at the 13,800 feet summit of Mauna Kea, I do regard long-term oxygen use as toxic to the human. This has been confirmed with discussions with my lung doctors that stated prolonged use would make my lungs become lazy and I would become dependent on it. It matched my experience on the extreme night shift that I was increasingly using it for longer and longer periods during the night, and it was less effective as time passed. Mental and physical health issues were significantly progressing during that time. It seemed to aggravate the altitude sickness to the point I hated the job and was trying to leave at the earliest opportunity. I developed a slow-growing knee tumor that had to be removed during this time. I was lucky it was benign. I was becoming increasingly sickly when home. My lung doctors always refused my request for oxygen prescriptions when I was having low oxygen health issues during sleep years later. They chose to treat it with increased air pressure from CPAP and BiPAP machines. So that tells you a lot about what doctors think about oxygen. So I'm going to the doctor, I've got low blood oxygen during sleep, and they're telling me they will not give me oxygen because it's going to make my health conditions worse. So they're choosing to treat my oxygen issues with high air pressure. from these CPAP and BiPAP machines. So these machines don't use oxygen, they use pressurized air. So they refused all my requests for oxygen while I had low blood oxygen during sleep. I still have low blood oxygen during sleep today. I run about 92% during sleep. So the Wikipedia article, Oxygen therapy, states, oxygen therapy, also known as supplemental oxygen, is the use of oxygen as a medical treatment. Acute indications for therapy include hypoxemia. So this is what they're doing on Monarch. It's low blood oxygen levels, so that's why they're doing it. You, on top of Monarch, you're running about 80% blood oxygen levels if you're healthy. If you're sickly, you're going to be significantly lower. So every time I went on the pulse oximeter on Mauna Kea, I would read about 80% at the summit of Mauna Kea at the WNKEC Observatory in this location. So that's low blood oxygen levels. All workers atop Mauna Kea have low blood oxygen levels, so be aware of that. So carbon monoxide toxicity. So the workers are also experiencing something similar to this. They're breathing industrial gas. And I have no idea how low their blood oxygen levels go when they're breathing the industrial gas. I've never measured it, so I can't elaborate on that, but they are working with industrial gas that has been released into the local indoor environment, and it certainly produces intoxication issues in the workers that work with it. So I used to experience intoxication when I would work with industrial gas at the summit of mountains in professional astronomy. So that's the carbon monoxide toxicity. It's very similar to industrial gas exposure. And cluster headaches. So everybody pretty much on top of Mauna Kea has headaches. So that's part of the summit brain condition. So a large reason why they're breathing oxygen is to try and get rid of their headaches. Oxygen is required for normal cellular metabolism. Okay, so they're deficient in oxygen on top of Mauna Kea because they're about 80% SpO2 up there. However, excessively high concentrations can result in oxygen toxicity. So I have no idea how high the oxygen levels go when they breathe oxygen on top of Mauna Kea because I've never measured it during being atop Mauna Kea and breathing oxygen. So nobody uses pulse oximeters to administer oxygen atop Mauna Kea. So this oxygen toxicity can lead to lung damage and respiratory failure. Higher oxygen concentrations can also increase the risk of airway fires, particularly while smoking. Oxygen therapy can also dry out the nasal mucosa without humidification. So the oxygen I used to use up there did not have humidification. In most conditions, an oxygen saturation of 94 to 96% is adequate. So most people up there are in the 80% level. So it's right around 80% in most healthy people on that mountain. It's probably below 80% in unhealthy people. So significantly lower than what they're saying is adequate. While those at risk of carbon dioxide retention saturations of 88% to 92% are preferred. So we're still below that without oxygen atop Mauna Kea. We're down at 80%. So they're saying 88% is the low, which is preferred. So they're significantly below that atop Mauna Kea without the oxygen. In cases of carbon monoxide toxicity or cardiac arrest, saturation should be as high as possible. While air is typically 21% oxygen by volume, oxygen therapy can increase oxygen content of air up to 100%. In 2018, the British Medical Journal recommended that oxygen therapy be stopped for saturations greater than 96% and not started for saturations above 90 to 93%. This may be due to an association between excessive oxygenation in the acutely ill and increased mortality. Okay, so that particular paragraph is saying you shouldn't do oxygen when your blood oxygen is above 96%, and it shouldn't be started until you're below 90%. So pretty much everybody should be on oxygen administration at the summit of Mauna Kea according to this. So they're about 80% when they're on top of the mountain. But the management team instructs them to wait until they start seeing summit brain before they use oxygen. So the management team want these workers going up to the mountain. They're malacclimatized to the very high altitude mountain summit. They're running about 80% up there, and they're instructed to wait until they see this condition of summit brain before they use the oxygen. So the management team is driving these workers into oxygen deprivation before they treat it. So these workers are yo-yoing in and out of oxygen deprivation all day long because they use intermittent oxygen when I work there. So they would only use oxygen for about 15 minutes at a time until the next episode of Summit Brain shows up, and then they use another maybe 10 or 15 minutes of oxygen to clear that episode. So they're repeatedly having these oxygen events that are bringing on Summit Brain during the summit day atop Mauna Kea. So that article is called Oxygen Therapy. It's on Wikipedia. It's much bigger than what's in this book. So the next article we're going to look at is called the Wikipedia article, Oxygen Bar. So an oxygen bar is a recreational oxygen bar. It literally is a bar. You go there, you can order drinks and things, and they have oxygen you can breathe in. So the medical profession warns that individuals with respiratory diseases such as asthma and emphysema should not inhale too much oxygen. So that was news to me. I'd never, during my training on oxygen in very high altitude astronomy, I never heard this about if you have asthma, you should not be using oxygen. So asthma is a very common condition. I have it, and I'm wondering why I was being told to use oxygen. So given that I do have asthma, there's certainly no warnings that people with asthma should not use oxygen. In fact, there was no warnings about the oxygen. The oxygen was presented as a harmless substance for the workers to clear the summit brain. There was no discussion of toxicity of the oxygen to the workers from the people that would train them to use oxygen. In fact, the training was so basic, it was quite shocking how basic it was. And they don't have medical prescriptions. They're not prescribed these treatments by a doctor. There is no medical prescription in any worker on top of the mountain. I'm not too sure how legal that is, given it's a controlled prescription drug in the USA. So it all seems very shady what's going on with oxygen atop Mauna Kea. So let's go on to the next one. So this asthma and emphysema should not inhale too much oxygen. So certainly there's no warnings being given to the staff about asthma and emphysema. Higher than normal oxygen partial pressure can also indirectly cause carbon dioxide narcosis in patients with chronic obstructive pulmonary disease, so that's COPD. It's quite a common condition in the population. The FDA warns that in some situations, droplets of flavoring oil can be inhaled, which may contribute to an inflammation of the lungs. Some oxygen bar companies offer safer water-based aromas for flavoring in order to maintain compliance and stay within FDA guidelines. Oxygen may also cause serious side effects at excessive doses. So if you take too much oxygen, you may start seeing some serious side effects. Although the effects of oxygen toxicity at atmospheric pressure can cause lung damage. So I'm going to read that again. The effects of oxygen toxicity at atmospheric pressure can cause lung damage. So we were never told that atop Mauna Kea. The low fraction of oxygen, 30 to 40%, in relatively brief exposures makes pulmonary toxicity unlikely. Nevertheless, due caution should be exercised when consuming oxygen. So I'm going to read that back to you. Due caution should be exercised when consuming oxygen. That was never told to us. In the UK, the Health and Safety Executive publishes guidance on equipment, including tubing, and on staff training, as well as warning on potential hazards, and makes several recommendations to ensure safe practice, principally to minimize fire risk. So this fire risk is pretty big around oxygen cylinders and people who are breathing oxygen. The people that are breathing oxygen can actually go on fire, so their clothing gets totally infused with oxygen, and it can make the clothing go on fire very easily. So another concern is the improper maintenance of oxygen equipment. Some oxygen concentrators use clay filters, which cause microorganisms to grow, creating an additional danger that can cause lung infections. So I'm going to just elaborate a little bit on how this oxygen bar is working up on top of Mauna Kea. And when I was there was no cleaning of the masks. The oxygen masks were all shared. There was like 3 oxygen cylinders that were out for public use. And there was some others in the first aid room, and I would see people in the first aid room using those cylinders. So my knowledge was there was no cleaning of these masks. They were shared, and it's a cross-infection risk, so you can get all kinds of infections by sharing oxygen masks. So this is a large group of staff on top of Mauna Kea, all sharing oxygen masks between them. And they're using them multiple times a day for intermittent oxygen administration to treat their summit brain. So it's very questionable what they were doing up there, and they're not being trained by a doctor. So nobody does a medical on these individual staff members and gives them an individualized prescription, which is what should happen up there. This all should be getting done by a licensed medical doctor who is familiar with acute mountain sickness, who understands very high altitude sickness, and understands how to prescribe oxygen. Now, I did not see any evidence that that was occurring at the WMKEC Observatory at the top of Mauna Kea. So there I am, I've got my summit brain because I'm up at 13,800 feet almost. I'm just short of the summit in that position, and there's no sign of any oxygen equipment on me. So there's no oxygen administration taking place. I'm running about 80%. I should be on continuous oxygen administration at this point, but I'm not. So I'm doing what the company wants me to do, which is they want me to develop summit brain before any form of oxygen administration takes place. And this is a significant fall risk area, so I'm at very high risk of fainting at 80% oxygen. And I'm not wearing any form of safety equipment to stop me from falling off the dome. So if you could actually see this dome, it's like standing up here on the edge of this. So it's kind of what that dome is like that I'm standing on. No sign of any full arrest equipment, no sign of any safety equipment to keep me safe if I faint up there. And you can clearly see there's nobody around me to catch me if I faint. And I've seen people faint up there. So the fainting effect's very, very well known to the WMKEC Observatory management team. So that's health and safety with oxygen. That's kind of the oxygen bar covered it, discussed the UK health and safety laws. So we're in the USA, and you need, as far as I'm aware, you need prescriptions for your oxygen in the USA for oxygen use. And there's no prescription here. Okay, so we're going to finish off. Oxygen administration should be done using a pulse oximeter, never administered above 96% SpO2, and not started for saturations above 90% to 93% SpO2. Medical oxygen administration is patient dependent and is a prescription RX only treatment in the USA. So that covers the law regarding RX only treatment in the USA. It's got to be done by a prescription from a licensed doctor. So nobody has prescriptions. I did not have a prescription for oxygen, but I was using it daily. I had no interview by a doctor to tell me what kind of oxygen treatment I should be doing. So nobody has pulse oximeters, so they're oblivious to what their SpO2 levels are. The management team keeps these people in the dark. It doesn't train them on SpO2 numbers, so people don't know what the numbers mean on the oxygen meters if they plug into them. There's a couple of oxygen meters in the first aid room from my memory. And the only time I ever saw them was when somebody had them out playing with them. And every time I put my finger in, it would always read about 80%. So there's no training on what harm these low SpO2 levels do to people, or what these numbers mean, and that you should continuously monitor them when you're at very high altitudes. So there's no continuous monitoring of SpO2 levels in the workers when I work there. So that's oxygen at the top of Mauna Kea at the W&Keck Observatories. Oxygen hazards. It's a very hazardous substance. It has a wide range of hazards, including cancer and genetic damage in fetuses and in humans that breathe it. So it's a very hazardous substance, and probably the biggest hazard is fire. So it can burn down the facility that it's in use in, and this has happened. Facilities with oxygen have burned down. There's definitely no doubts about that. And talking about fires, see this telescope here? It's called the Subaru telescope. It went on fire. My understanding is it may have actually been on fire twice. There's certainly been 2 nasty accidents. I think one may have been a fire. I think one was maybe a forklift truck fell on a person. So it gives you some indication of what low oxygen levels can do in workers. So there's definitely been a fire in this facility that killed some people, and it sent a lot of people to the hospital. And there was a forklift truck accident, I believe, in there. You'll have to look it up. But I believe it was a forklift truck fell on a person or crashed. It seemed to kill somebody. I'll have to look that up, but I would recommend that you look up the Subaru telescope and find out about the worker fatalities on this one. So that's the Subaru telescope. It's had a lot of issues with worker deaths and worker health issues that are documented. And it may well have been coming out of this oxygen deprivation and the summit brain that the workers are kept in, and what I regard as the misuse of oxygen that is occurring at the top of Mauna Kea in the workers. And it's possibly illegal what is going on up there with the oxygen cylinders and the lack of prescriptions and not doing an individualized oxygen plan for each worker. So some shady stuff going on with oxygen on top of Mauna Kea. So that was toxic altitude. And I should mention that if you're kept in this state of toxic altitude for a long period of time, it seems to lead on to this hypoxia, mental illness, and chronic fatigue. So you want to find out more about that condition, you can find it in this book. And the first book I wrote regarding sickness was Health Forensics, and it was written before I understood my sickness was coming out of these toxic altitude effects, which had led me into hypoxia, mental illness, and chronic fatigue. Please like the video, please subscribe to the channel, and I wish you the very best of health. Thank you.